What's going on, Chattanooga? It's your girl, Zainab K, here with Brewer Media Group, and I am joined by the wonderful Neeya Patel. How are you doing?
I'm doing good today. How are you?
I am wonderful. Excited to hear all about you now. You guys, she is a part of the More in Common Alliance partnership. This is between the Morehouse School of Medicine as well as Common Spirit Health, which is CHI Memorial's, our local hospital, parent company. And this partnership addresses health inequalities in underdeserved areas as well as the staffing shortage in the medical field. So we're going to find out all the benefits that it has for us here locally and what you're experiencing throughout the program. So, Nia, if you will, tell us what you're studying and how you ended up in the More in Common Alliance partnership.
So I'm a third year medical student and I'm currently on my internal medicine rotation. And I actually found out about the Chattanooga site during my OB-GYN rotation. I was just talking to one of my classmates and she basically said she had an awesome time there. And I had been at Grady for most of my clinical rotations thus far. So I was, kind of ready for a little switch up. And, it wasn't
Mm,
to like escape anything, but I wanted to just broaden my training just a little. And
yeah.
she told me that, over there, it was just me and attending. And from what she said, it was more involved. It didn't feel just like a shadowing opportunity. So I felt intrigued by the idea of working in a setting where it's just like a student attending relationship. And there wasn't any like levels between us. I guess like all of my experience up until Chattanooga was like, I'd go see my patient, I'd talk to the resident, then the resident, would talk to the attending. And here, that middle layer kind of got taken away, which was nice in a sense because it gave me an opportunity to grow differently. So that's ultimately why I decided to come to Chattanooga.
Yes. Now, in your own words, how would you describe the program to someone who's never heard about it?
It was very organized, and I guess like easy to get help when I needed it. So I remember like getting onboarding, that was
Mhm.
like a lot clearer and it happened very quickly and I was, my first day in, I was able to access Epic and do everything, which was really nice. Um, yeah, does that answer that question?
Yes, 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 girl, you're so fine. Now, medical education has historically lacked diversity. Now, from your perspective as a More in Common Alliance student, right, what barriers do you think still exist for students from underrepresented backgrounds, and how effective is the program in addressing them?
Yeah, so I guess with students coming from underrepresented backgrounds, sometimes it's a little hard to find mentorship and, like seeing other people in the medical field who look like you. And even just like being a woman, like we know that medicine is mostly male dominated, at least at the physician level. And I think with the More in Common Alliance, especially with the Chattanooga site, Dr. Panda is awesome. And she does a great job of, welcoming everyone, sharing her spirituality, like all of that. And I thought that was really nice. And, she's a forefront and she's a leader. And you can tell just on talking to her, like just the first time I met her, I could see the passion she has in this program and like how much she really wants to bring and diversify medicine, especially in Chattanooga. And I think in terms of for Morehouse students specifically, a lot of our training is done at Grady, which is a very
Yeah.
great hospital, and you're exposed to a lot. But it was a different patient population that I got to work with in Chattanooga. A lot more like chronic problems. Like I would say one difference was, at least that I've noticed, is most people at CHI, like the patients I saw, tended to have a little bit more health care than like the patients at Grady, just, given, how Grady is set up.
Yeah.
But in turn, like I got to work with a very different patient population, a lot of people with chronic problems, a lot of older patients. And overall, I think that just is broadening my training and, will help prepare me to be a better resident.
Yeah. Now, as you were talking and explaining that, I was getting that notion of this just exposure to the different kind of situations, different kind of patients that will also give you the experience, even though you're in your third year, to handle different kind of situations and also see what direction you really want to take your career in.
Yeah. That's definitely true. And I think too, the nice thing with Chattanooga was, I guess in Grady, I didn't really feel like I interacted at all with like the consults, but because it's just an attending only place, like when the doctors I was working with would need a consult, like I would hear the conversation with the specialist. And that was a nice experience to have as well.
Well, we all love that, like one-on-one teaching, or just even knowing that what you're pursuing, there's someone there that is here to help, but also cares about how you're learning, not just, oh, here you go. You said you want to be here. I'm giving you this, and then you're on your own. We're throwing you to the wolves. So it sounds like you just have a lot of hands-on mentorship and experiences with this program, which I love for you. Now, from your perspective, also, what are some challenges or drawbacks of the regional campus program, if any, that can be changed? Or if not, tell me what has been one of your favorite things to learn and do as part of this More in Common Alliance partnership.
Yeah, I didn't really have anything per se that I
Mhm.
would like, suggest to change in terms of the program. What I guess I was surprised about, and I was like, like pleasantly surprised on how it shaped my development as a med student was the ability to really just work directly with the attending. So
Mhm.
I carried a few of my own patients, and the attendings I were with really let me kind of run the show, which was nice. Like I'd go into the room, talk to the patient, and after I would talk to the attending and be like, this is kind of how I want to adjust their management. And what was really nice was like, again, because it was just me and the attending, and
Yeah.
there was more, I guess maybe time and like, less people around. So I got that one-on-one mentorship. They were able to actually like, instead of replacing my plan, they were able to help me refine it and
Mhm.
understand kind of like what development looks like. In terms of, shifting a plan, but also like when someone like an attending is invested in my thinking process and not just the answers I came up with. So I thought
Yeah.
that was like very helpful.
Okay, now I probably should
Yeah.
have asked you this from the beginning, but what sparked your interest in joining the medical field as you are in your third year? I'm sure the answer might have changed, but what initially sparked your interest in being a medical professional?
So I was raised by two doctor parents, so I was always kind of surrounded by medicine. And I always kind of like was keen with the sciences. I liked biology and not so much chemistry, but I did like biology. And I guess kind of I started exposing myself to various things like even from a young age. Like I know my dad came in for career day when I was in kindergarten and he did like echoes on people and I thought that was the coolest thing. So that kind of initially sparked it. And then
Mhm.
just as I got older, I started to immerse myself. Like my senior year of high school, I worked with a pathologist. My high school actually had like a month-long thing called Jan Term where we were either able to do an internship or like a course that wasn't like, your basic school stuff. And I chose to do this internship with a pathologist. And I guess there was really where I learned that I could stomach all of medicine, like,
Mhm.
like all the blood and the organs. And then through college, my sophomore year, I became an EMT. And that kind of really, like solidified that this is what I wanted to do. And it was also during
Mhm.
COVID. So, it was a really, I guess, like scary time, right? And I was
Yes.
transporting a lot of COVID patients and it was, before the vaccines, but just being in the hospital setting and like, I remember my first transport into the ER, and I actually transported this patient to Grady, but just seeing how the ER ran, like it really kind of solidified that this is what I wanted to do. And, now being a third year med student and actually working with patients, like the fulfillment that I get from being able to even like have a conversation with the patient. Like I can't prescribe anything yet, but a lot of times like I'd go in there and talk to a patient and they'd be like, "Hey, like, can you tell me a little bit more about that?" Just because sometimes, I mean, the attendings have to see a lot of patients in the day, and patients when they first get thrown a lot of information, need time to process it, so they don't quite know how to ask the right question. So when I would go in the morning, like that was really nice, and like them, thanking me, and like in Chattanooga especially, the
Yeah.
patients remembered my name, which was really nice because like, I was like, I think when you have so many people going in and out of the room like it is at Grady. The patients sometimes, like there's just so many people touching them. But when it was just me and the attending, like they remembered, oh, like this is the med student with the attending. So yeah.
But we're lucky to have you. Sounds like you also want to stay here and not go back to Grady. But we definitely love the spirit, love the passion that you have, and we definitely need more professionals like that. I enjoy having someone who is excited and cares about me when I'm feeling down and I go to the hospital or even a doctor's office. So thank you, and I hope that you're able to connect with other professionals and rub off some of that goodness, that good spirit of yours. Now, speaking and thinking on your journey and on everything up until now, if you were to advise another medical student considering rotations or joining the More in Common Alliance program, what would you tell them?
Yeah, so what I would totally recommend someone to go. I've told multiple of my friends once I came back, like if you have an opportunity to go to Chattanooga, you should. And I don't like compare it per se to Grady, but I frame it as just, a different kind of learning experience and environment that will just enhance them as, a third year med student. And like while Grady provides a different sort of training that's excellent as well. Chattanooga just offers a unique style with like again the direct supervision, the close mentorship, and like the early involvement. One thing that was also really great was like by day 2 or 3, I was already having like 3 or 4 patients that were my own, which was nice. And in a place without residents, you're not just like waiting on the sidelines, you're definitely like part of the team. And the attending wants to hear what you have to say. And it's also like it's really nice. Like if you have a question, you can just ask them and you get an answer right away. And that immediate, feedback and learning definitely enhances like you as like a future physician. So
Well, I thank you so much. And I pray that this definitely touches more of these young students' hearts because we need professionals like you. I thank you so much for joining me this morning. Chattanooga will have more information and we'll continue to learn about the More Common Alliance as they are changing our communities in the world as we know it, one medical professional at a time. So thank you so much, Nia.
yeah,
We'll have this up on our website. And yeah, you have a wonderful day. And thank you
thank
so much
you.
for all of what you do.
Of course. Bye.